Boa tarde, Carla.
Boa tarde, tudo bem?
Tudo jóia.
Boa tarde, Sinira. Boa tarde aí a todos e todas.
Carla, você pode fazer um teste de compartilhamento de tela?
Eu não vou precisar.
Ah, ok. Obrigado.
Nada.
Boa tarde, Pedro, tudo bem?
Bom, boa tarde, tudo bem, gente? Boa tarde a todos.
Boa tarde.
Oi, professor.
Oi, Marina, tudo bem?
Fechado, Marina.
Olá, tudo bem?
Tudo certo, obrigado por estar conosco aqui.
Obrigada, Pedro. Eu que agradeço o convite.
Pessoal, só
Olá,
para tirar uma
Carla.
dúvida. A Silvia e o
Tudo
Gustavo
bem,
irão
Maria?
entrar?
Sí, doctor Gustavo ya está acá. Doctor Gustavo, buenos días,
Hola, buen día.
¿cómo estás?
Bien, gracias. ¿Ustedes?
Bien, gracias. Qué bueno. ¿Tienes una presentación que quieres probar? Yo vi, usted ha enviado la presentación para nosotros.
Sí.
¿Quiere presentar, quiere hacer la presentación o quiere que nosotros hagamos para usted?
¿Ustedes pueden presentarla?
Sí.
Creo que es más fácil. Yo he tenido problemas para hacer esas presentaciones en Zoom y para no meternos en problemas de tiempo y esas cosas. Mejor ustedes, si es posible.
Ok. Voy a probar una vez más, ¿ok? Para ver si está todo bien.
Muy bien.
Silvia disse que vai, tá tentando entrar, ela vai entrar em instantes.
¿Está bien así?
Está perfecto, sí.
Entonces, cuando yo presentar, por favor, dime cuando quiera que mude los slides, ¿ok?
Muy bien, perfecto. Gracias. Sí.
Ok, gracias.
Una pregunta, Juliana.
Sí.
Yo invité a una colega que trabaja conmigo en este tema de interprofesionalidad para que viera el panel y todo. ¿Ella puede estar?
Sí, ¿qué piensan los profesores? ¿No hay problema? Pienso que no hay problema. Ella está acá con nosotros,
En cualquier momento se conecta, sí.
Ok,
Es solo una. No,
ok.
no
Ella
es
va a
mucho.
usar el mismo enlace que
Es
usted.
el mismo link que yo, sí. Ujú. Pero va a poner su
Voy a
nombre.
preguntar si no hay problema.
Ok.
Luiz,
Oi.
Luiz, uma outra palestrante vai entrar usando o link do Dr. Gustavo, que ele disse que ela vai ajudá-lo na apresentação. Tem algum problema?
Não, eu posso mudar o nome dela depois.
Ok, obrigada. Doutor Gustavo, não há problema. Ele pode utilizar o mesmo enlace.
Perfecto. Muy bien. Gracias.
Oi,
A
Sil.
Silvia acabou de entrar.
Entrou.
Professora
Sim.
Silvia está aqui.
Oi,
Professora Silvia?
pessoal.
Oi, professora.
Boa tarde.
Boa tarde, Sylvia, tudo bem?
Boa tarde.
Tudo. Desculpa aí um minuto de... Atualizei o computador e a senha e não sei o que houve, mas deu certo agora. Tudo bem, Marina, Sinira, Pedro, Carla? Que
Olá,
bom.
Sylvia,
Tudo
tudo
certo.
bem?
Já está aberto para o público?
Ainda não.
Ah, tá certo, então. Quem que está controlando?
Luiz.
Ah, Luiz.
Luiz? Luiz, do YouTube está tudo certo também, né?
Por enquanto, sim.
Obrigada.
Só me avisarem que podemos iniciar daí.
Eu acho que já podemos, né? O que as professoras acham?
Não podemos, não vamos atrasar, não.
Vocês já fizeram os testes com os tradutores, tudo ok, né?
Ok. Podemos começar, pessoal?
Sim.
Beleza, vou iniciar o webinar aqui e podemos começar.
Olá, boa tarde a todos e a todas. Sejam
Good
muito
afternoon to
bem-vindos
you all.
ao webinar
Welcome to the
Interprofessional
webinar Interprofessional Education, the Experience of
Esse webinar tem
Nursing.
como objetivo
This webinar
compartilhar as
aims at
experiências
discussing
do
the
Brasil
experiences
e
of
algumas
Brazil
novidades,
and the
ideias,
opportunities and
desafios
strategies,
relacionados à
challenges
educação
related
interprofissional.
to
Meu nome é
interprofessional
Bruna Moreno
education.
Dias, eu sou
My name is
consultora
Bruna Moreno
PAHO,
Dias,
doutoranda da Escola
consultant from
Tecnológica de
PAHO
Rio Preto.
and a
Em
doctorate
nome da
student
comissão
of the University of
organizadora
Rio
deste
Preto.
evento, eu
In
agradeço
behalf
a
of the
presença
organization of
de
this
todos.
event, I'd like to thank you all
Antes
for
de
your
começar, eu
presence.
informo que
Before
esse webinar
starting,
está sendo gravado,
I'd like to
os
inform
dados
this
que
webinar is
será
being
disponíveis
recorded.
posteriormente.
The recording will
E
be
também estamos,
available
além
further
da
on.
transmissão aqui no
And
Zoom,
besides the
com a
broadcast on
transmissão no
Zoom,
canal de
we also
YouTube da Escola de Enfermagem de
broadcasting
Ribeirão Preto. Nós
on
contamos com
YouTube in
tradução
the School of
simultânea aos
Nursing of
idiomas
Ribeirão
espanhol, inglês
Preto.
e português.
We have simultaneous
Para aqueles que
interpretation
estão
for
no
English and
Zoom, é
Spanish
possível
and Portuguese.
selecionar o
For those in
idioma no
Zoom,
ícone
you
de
can
globo que está na
choose the
parte
language on the
superior
globe
da tela.
icon
E para aqueles que
below.
estão no canal de YouTube, é
And
possível selecionar
on YouTube, you may choose
direto no canal
the
de
link
acordo com o idioma de escolha.
according to the language of
Bom,
choice.
então, dando início ao
Well,
nosso evento,
starting our
o
event,
professor Pedro
I'd like to
Palha,
invite
que é
Professor
diretor da
Pedro
Escola
Palha,
de Enfermagem de Ribeirão Preto, da
Vice
Universidade de São Paulo, para fazer suas
Dean of
considerações iniciais.
the
Obrigada,
Nursing School of the
seja
University of São
bem-vindo.
Paulo. Thank you, Pedro.
Bom, boa tarde a todos.
Good afternoon to you all.
Que estão participando.
Good afternoon to all participants. In this first moment here, I'd like to greet the members of the panel, as well as like to greet everybody following us in our social networks. In this very important event organized by the Nursing School of Ribeirão Preto, in the Collaboratory Center of PAHO, in our school. And first, I'd like to greet Professor Sylvia Cassiani, who's the Pan-American Health Organization, PAHO WHO, United States, who is being with us in this event. in behalf of on behalf of which I'd like to greet all the participants on this floor, as well as our speakers. In behalf of Professor Ventura, director of our collaborative center, I'd like to greet all the participants following us together with in our social networks. I'd like also to greet Bruna Moreira Dias for the moderation. And this is a very important event for us to discuss the experience of nursing. This is a theme, extremely important theme in the disciplinary point of view, but also in the interdisciplinary information as well as interprofessional. So it is a great challenge with the healthcare professionals for the nurses. So I'd like, in behalf of the nursing school and Professor Maria Elena, and who unfortunately couldn't be with us at this moment due to other commitments, I'd like to wish you all a great event for all of us, and may we have good experiences reported by our speakers, both national as well. And I hope we can have a great webinar. Thank you very much.
Obrigada, professor Pedro. Convido agora
Thank you,
a professora
Professor.
doutora Carla Arena
I'd like to
Ventura,
invite
que é diretora do
Professor
Centro
Ventura,
Colaborador
Director of the Collaboratory Center of the Pan American Health Organization,
Pesquisa em
for the
Enfermagem.
development of
Professora
research and learning. Professor Carla,
Muito obrigada,
please.
Bruna.
Well, thank you,
Boa
Bruna.
tarde a todos e todas.
I'd like to thank all of you. First, I'd like to
Pedro Palha e
to greet
doutora
Professor
Sylvia
Palha,
Cassiani,
as well as
que
Professor Cassiani,
integram esta mesa de
who
abertura,
integrates this opening
e
floor
afirmar
with
que é
us,
uma grande
and
honra
to say that it is a
estarmos
great
juntos
honor
neste
to be
webinar
with you in this
Educação
webinar, in
Interprofissional
the Interprofessional
e
Education
Ensino
webinar,
Enfermagem.
the experience
A
of nursing.
pesquisa desenvolvida
The research
será
developed
apresentada
that
hoje,
will be
ela
presented
constitui uma das
today,
atividades
it
do
constitutes
nosso
one
centro
of the activities of our
colaborador
collaboratory
da
center
OMS para o
of
desenvolvimento
PAHO
da pesquisa
WHO
em
for the
enfermagem.
development of the
Ela
nursing
compõe, então, o nosso termo de
research. So it
referência
composes our
1,
TOR,
que estabelece
one that
como
establishes
propósito
as
colaborar
the
com a
purpose
OMS
to
OPAS
collaborate with
no
WHO,
fortalecimento da pesquisa em
PAHO,
enfermagem
with the
para o
strengthening of the
desenvolvimento de
nursing
recursos humanos e da prática
research
enfermagem
for the
nas
human
áreas
resources and the practice of
prioritárias.
nursing in the
Então,
priority
essa
areas.
atividade, ela
So this
reforça o
activity
quanto é
strengthens
importante
or reinforces how important
avançarmos as
it is
discussões
for us to
sobre a
advance in the
educação
discussions
interprofissional,
on interprofessional
especialmente
education,
no âmbito da enfermagem,
especially in the
para
scope of
uma
nursing,
maior integração e
for a better
fortalecimento dos
integration and
serviços de saúde.
strengthening of
Nesse
health services,
sentido,
healthcare services.
eu
And in that
agradeço
sense,
muito
I'd
às
like to thank
professoras,
the
doutoras
professors,
Sinira
doctors,
Magali
Dr. Sinira Magali
Fortuna e a
Fortuna
professora doutora
and
Ana
Professor
Maria
Dr.
Laus
Ana
por
Maria Laus
coordenarem o
for
grupo de trabalho
coordinating
da nossa
the
escola,
work
da
group
Escola
of
de
our school,
Enfermagem de
of
Ribeirão
the
Preto, da
School of
Universidade de
Nursing in
São
Ribeirão
Paulo,
Preto,
que
University of São Paulo,
desenvolveu com
who
excelência
has
esta
developed
atividade.
with
Muito
excellence this activity.
obrigada a
Thank you very
todas e
much. I'd
todos
like
os
to
integrantes
thank
deste
all
grupo
the
de trabalho.
members of this
Eu
work
também
group.
gostaria de agradecer aos nossos
I'd like to thank
convidados
our
que
guests
gentilmente
who
aceitaram
kindly
participar
accepted
deste evento, aos centros
to participate in this
colaboradores da
event
OPAS,
in the
OMS,
cooperative
Brasil,
centers of
e que estão aqui
WHO
para
PAHO,
compartilhar
who are
conosco
here
suas
to
experiências
share
ou
with
até
us their experiences
perspectivas
and their
sobre o trabalho que
perspectives
foi desenvolvido na
on the
nossa
work
escola.
carried out
Eu
in our
também
school.
aproveito
I'd
esta
like also
oportunidade
to
para agradecer
make use of this
na
opportunity
pessoa
to
da
thank,
professora
in
Sylvia
behalf
Cassiani,
of
todo o
Professor Sylvia
apoio que a gente
Cassiani, all the
recebeu da
support we have
Organização
received
Pan-Americana da
of the Pan American
Saúde,
Health
tanto da
Organization,
sede em
both
Washington
in the
quanto da
headquarters in Washington,
participação aqui no Brasil.
D.C., as well
Tenho a
as
certeza que esta
here in
será uma
Brazil. I am
oportunidade
certain
extremamente
this will be
rica
an
de
extremely
trocas,
rich
de discussões
opportunity for
sobre um
exchange, for
tema tão
discussions
relevante para a
on such a
enfermagem.
relevant theme
Desejo,
for
então, a
nursing.
todas e todos um
I
excelente
wish all of
evento.
you a
Muito
great
obrigada.
event. Thank you very much.
Muito obrigada, professora Carla. Convido
Thank you,
agora a
Professor
professora
Carla. I'd like to
doutora
invite
Silvia Helena de Borto de Cassiani,
Professor
que é
Sylvia
assessora
Elena,
regional de enfermagem
Regional
e técnica
Advisor
de
for
saúde da
Nursing
Organização Pan-Americana da
and
Saúde,
Healthcare
em
Technicians
Washington,
of
D.C.
the Pan American Health Organization in
Obrigada,
Washington, D.C.
Bruna.
Thank
Buenas
you, Bruna.
tardes
Good
aos
afternoon.
participantes de
to the participants of Latin American countries. Good afternoon, rather, for our Brazilian colleagues. It is a great pleasure to be representing
da Organização
the Human
Pan-Americana,
Resources in Health in the Pan-American Health Organization in DC, and participating in a theme that for us is extremely dear, to talk about interprofessional education and collaboratory practices, although it is not a new theme for many of us. Throughout the pandemic, in the integrated work of doctors, nurses, physical therapists, psychologists, occupational therapists, well, has shown us the importance of advancing in this collaboratory work, not only with education, but also in the practices of the healthcare services, in the collaboratory work. Besides the pandemic, we all have in PAHO, we have been monitoring the implementation of interprofessional healthcare plans for the countries in this region. And we've seen that many of the countries have advanced in this topic, fortunately. We may say that in the past 5 years, we've had an increase of over 30% of the countries that has implemented or at least started discussing implementation plans of the interprofessional education. For us, to have nursing leading these processes and discussing all of that is also part of the global direction of nursing and midwifery 2021 and 2025 that has been approved by the World Health Organization, that also deals with the importance of nurses working in a collaboratory, interprofessional way. And also we've been monitoring indicators in the participation of nurses, or either participating or leading interprofessional teams. It is for us, therefore, a great pride to be participating together with our collaboratory center of the Ribeirão Preto Nursing School in this event of today. And we want to hear all the works that have been carried out and in some countries that has implemented on that sense. Well, I'd like to thank Professor Pedro, Professor Carla, and all teachers, all professors of the nursing school that has led that. And let's hear now their presentations. Thank you, Dr. Sylvia. I'd like to thank everybody in the opening floor for the participation. And I'd like to invite Professor Dr. Sylvia Fortuna, who will make the presentation called Interprofessional Education and Health, the assessment of nursing courses in Brazil. She's a nurse, has a master's degree by the Nursing School of Ribeirão Preto. She has a postdoc in France with institutional analysis of sciences of education. She has experiences in the healthcare implementation of health programs, and she's associated professor of the Nursing School of Ribeirão Preto in the Collective Health Institute. She works as chair of the International Foreign Relations of the Nursing School of Ribeirão Preto, and she hosts research with operational courses, teamwork, collective healthcare, and others. As was mentioned prior, Professor Sinira, she's the coordinator of the project that will be presented, called the Interprofessional Education for Nurses in Brazil, and she will share with us the result of this project. Thank you. Thank you, Bruna. Good afternoon to you all. It is a great pleasure, and I will share my screen with you, that it will be best for you to see.
Eu inicio aqui agradecendo.
Well, I'd like to start by thanking you and for the opportunity that we are having today of debating this topic of interprofessionality in health, in nursing, and to show some nursing courses, the assessment of some nursing courses in Brazil. I'd like to highlight that although this is my presentation, this comes from a collective work of learning and a lot of cooperation among the people who are part of it. So the team is composed by professors in the nursing, as well as dentistry, students, post-graduation students, masters and doctorate, more experienced professors, others in the beginning of their careers. And we have both alumni of our course, so doctors that also are part of other public institutions as well as private ones. So the set of people that I announce here, well, they have produced, that I have listed here, that have produced this survey, this research that we're going to show. So just to bring a little context, considering that we are talking about our colleagues with the Latin America and, well, the Americas. In Brazil, we've had important cornerstones that have signaled the need of changes in the training, both of healthcare professionals, as well as the organization of services and their management. One of the parts that we have, the most important cornerstone that we have, was the 1988 Constitution that ensures health as a right of citizens and a duty of the state. And here we have the proposition of the unified health system. Another important cornerstone in our country was Law 8080 of 1990, one of the organic laws of healthcare that appoints the unified health system as the leader of the ordinance, as well as the training of the labor force in healthcare for the country. And in these aspects, well, they're very important because in these 31 years of implementation of the unified health system in our country, we've had advances, yet we still have challenges both in the initial training of healthcare workers, as well as the services training, so the permanent healthcare education. So we consider interprofessional education as being a powerhouse to promote the elaboration of teams of workers that are able to work among their peers, among their other teams, and with the users, producing the wholesome healthcare. So it may be a strategy linked with other initiatives that we call IP, interprofessional, together with other strategies that must be renewed, reactivated, and fostered, such as the national education healthcare or healthcare education, the multi-professional residence courses, as well as labor education, pet health, and including the last edition that we've had, which was dedicated to interprofessionality, among other initiatives as well. So how about nursing? Well, you know, nursing constitutes a very important labor force in healthcare, and we are mostly, well, the professionals that participate the most as labor force in healthcare. 59% of the labor force in the world. In the Americas, we are 56% of this healthcare labor force. And for us, it was something that made us uneasy, to understand how such an important healthcare category has been dealing with this interprofessional education part. So with that, we have established the objective of analyzing the nursing training in Brazil with regards to IP. And we've carried out a descriptive study developed in 2 steps. Well, the first one was the course survey, the active course survey, and themes on the study. And at a second moment, we had a document analysis, especially the political pedagogical project. And in our chronology, in our timeline, just for you to see, these studies started in September 2019, and we just ended in November 2021. And there is the importance of bringing and being discussing this theme with you. And we are able to hear, well, criticisms and everything. So we did a survey of the number of nursing schools in Brazil, active courses through EMAC, which is an electronic system of the follow-up of processes that regulate higher education in Brazil, the Ministry of Education and Culture, and the electronic website of the educational research. So here we started in 1,340 groups with some inclusions, and we reached 1,200 courses in these. You can see in the map, these in the Southeast region and Northeastern region, most of the courses, but also in our assessment, well, it has gone through courses in all the regions of our country, which is very important for us. And if you don't know Brazil, it is in the southern and southeastern region that we have the largest number of universities and healthcare training courses. So this is very important for us to think about. So in step one, we sought these documents and we tried to identify in them some terms that could indicate the presence or the potentialities of the interprofessional. So the terms listed was interprofessionality, multi-professional for collaborative practices, collaboratory work, teamwork. And here, I like to show you the result of what we have found. Most of the courses mention interdisciplinarity, 47.1, followed by multi-professionals, 39.5, and there are the important mentions of the teamwork. And you notice here that we came to 903 courses, 26% of those courses did not have available documents for analysis. So we reach this look at things, well, we reach 200 courses that were the ones in the upper quarter with 3 or more terms, and we have included the ones that explicitly mentioned interprofessionality, collaboratory practices, in a total of 11. And we have adapted a bar script for which is a reference in the word that was translated by Miranda et al. And this instrument of data collection was composed by 36 items with field that has a description of the characterization of course, the questions regards targets and objectives, and the incorporation of learning, and the theoretical referential, or if it was adoption of practices, evidence-based practices, the learning and the involvement of representations of other professionals and caretakers, and as well as the learning in this very program. So here we see that most of the documents analyzed were the political pedagogical processes, so PPP and PPC, and in the objectives of the course, we see it is quite incipient, the courses that state the interprofessionality as being the objective. So only 2.6% of the courses mentioned that in their objectives.
The collaborative practice in 0.4%. And the mention in professional internship. And we highlight here in the strategies of teaching the issue of problems and problem making, and it can also favor, such as the problem making can favor the collaborative competencies, such as the living with peers and the exposition or exposure of points of view and ideas. And And in the second stage, we also consider the professional values. And so let's see, if we consider values and possibilities, such as a joint work developed between professionals and patients and families, and we can get to a number that of 57.2% of courses that can be show values, remembering that here we are mentioning a quantity that is very inferior, of very small in nursing courses. So it also seems very little the professional interprofessional, and considering the courses. And we're getting to the number of courses that is an indication of this kind of situation, and it can talk about some professional aspects, and it's not institutionalized or declared documents, and the documents point to this interprofessional situation. And when it's mentioned here, the interprofessionality in practice, and there is also a possibility in terms of extracurricular activities as well. We also would like to highlight that out of the 52 courses, for example, 12 had the ability to be together with other areas such as pharmacy, occupational physiotherapy, and one course announces 2 disciplines interprofessional, one that is more theoretical and the other that is more practical. And in these 12 courses, we have strategy that can favor the interprofessional aspect, which is work with small groups, strategies of problems creation, and approaching transversal or horizontal topics, valuing popular knowledge. And there is another course as well that is called Program of Community. And this discipline also approaches other healthcare areas, and it says that there is experience that is a community experience of the students. And I also highlight that 11 of the courses represent the teachers in the National Health Unified System. And in SUS, we also have, it's reported the issue of primary care and the complexity of care, and the longitudinal aspects of the families. And here we have an indication that this is possible, and it's also necessary to articulate the issues of others and for other populations as well. And 5 courses only that were identified to develop activities that will be able to integrate the teachers and with discourses as well. And in this exception, and from the very beginning for us, it's also highlight as a potentiality in the interprofessional issues. So based on the studies, I'm gonna start my final remarks. We pointed some perspectives that in recommendations as well that were made, and to include in the curriculum directives of nursing, the interprofessional teaching as one of the values for the whole care in healthcare, to have in the review of the pedagogical project, the nursing courses in the moments with different joint discussions. And we also should think in suggesting guiding the curriculum for social needs in the national healthcare, incrementing the interprofessional approach of relevant topics such as neglected diseases such as leprosy, tuberculosis, and malaria, and other ones. And we just have to remember that Brazil is the country with the second number of cases of leprosy, and now it's the first one. You can see how important that is. We also have to approach topics such as gender, racial, race, violence, environmental healthcare, among others, with the emphasis in interprofessional education involving other professionals and students, as well as other activities of the social sector. So we going over the walls and the limits of nursing and healthcare to propose interdisciplines with active methodologies that allow the exchange of knowledge between teachers and students, include reflections in the different disciplines about the articulation of nursing practices connected to other professional practices, connecting and seeing as a whole. And you can emphasize mental health and healthcare of the population, of homeless population, people that are in jail, palliative care, health, basic care, elderly care, emergency care, indigenous care, Black population care, and also the unique healthcare in 2030 agenda. And another recommendation is to increment the approach about the integrative practices in an approach that is interdisciplinary and intercultural, valuing the practices and the other types of cares, including the final paper of courses, TCC, and in the session dedicated to the reflection and in the problem approach to TCC, aiming the development of the interprofessional logic. I hope it was very clear. I thank everyone, and I'm here at your disposal for our talk. Thank you very much. Thank you very much, Professor Sinira, for the presentation of the results of that was such a broad range. And now we're going to start a discussion panel that has the topic interprofessional education perspective and opportunities. Our first presentation is the presentation of John J. Bird from Canada, but unfortunately for reasons that we cannot explain now, and he's not the part of it, and we'll continue with the panel members now, and we invite Professor Larissa Carreira for her to talk with us. Professor Larissa is a doctor. She has a master's degree in university teaching and doctorate in medicine. She's the director of the medical sciences college in Santa Fe in Argentina, where she works as a professor and a researcher. She's also the director of the projects of research in personnel course studies and Center of Studies in Innovation and Social Sciences and Health Sciences, and she is also a member of the executive committee of the network of interprofessional activity in the region of Americas. Professor Larissa, I thank you profusely for your participation. You can start your presentation. And with the professor that will come after that, who's the Professor Gustavo, because the lack of the participation of Professor John Dilbert, you can go over the limit here. You can start your presentation. Thank you very much for the invitation. For me, it is very good to be here today. Firstly, I'd like to thank you for having invited me to participate, because I believe that this initiative, they provide great contributions for the development and the interprofessional education in our region. So to keep the flame alive, to keep the fire alive, it's important, and to ask for many professionals and teachers and professors to commit themselves to interprofessional education is a huge responsibility that we all have. That's why I celebrate this for this reunion at this meetings, and I thank you for having invited and to share with you my experience. And the second thing that I thank you is that you have allowed me to share the results of this investigation, this research, because I believe that one of the main issues that we also have to approach, and we're also interested in the interprofessional education, has to do with research and the possibility to generate evidence that will allow us to make decisions As we mentioned in medicine, medicine is based on evidence. When we make clinical decisions, the decisions in the medical education também have to be based on evidence. In order to have them, we have to research. And we can also have a research from other countries that have realities that are very distinct, very different from ours. So, and therefore, these local researches and studies in the region of Americas have a huge importance and weight in our decision-making process. Secondly, I'd like to say that I'm going to share a presentation, a PowerPoint presentation, because I'm going to tell you a few experiences as I presented. I'm part of an academic network of interprofessional education of the regions of Americas, and I'm also part of the interprofessional network of professionals in the countries from starting in 2016 up to the year 2019. And I could see I could share with many people that came from the ministries and the universities and the services of healthcare initiatives in relation to interprofessional education. And what you've been talking recently in terms of investigation seemed to be very important for me, because we, as Sylvia presented early today, she said that many countries committed to action plans between them, and among them Argentina in its action plan committed to develop an experience, a study of the experience of interprofessional experiences. And this collection of experience was funded by the Ministry of Health in the year of 2017, 2018 in Argentina, where PAHO also participated, and the community, and also the Argentina Forum of Colleges of Medicine, medical schools and public schools. Why do I mention this? In this research, we also managed to find a development that was very basic and of interprofessional education. And it's also a study of the reality of colleges of science of healthcare, and where there was medical school and obstetrician courses or nutrition as well. And we also found that in many of these medical schools and these colleges, there were experiences where students of different careers could learn together, to work together. And that put in evidence the need to generate different strategies to be able to get to the professors and the managers of education managers. Because I'm a professor and I understand that the important thing is to have a leadership on parts of the professors and teachers and director of careers, and a commitment and in a leadership that is committed to this type of experience of education. And we are going to share with the experiences that we saw and in the region of Americas, and starting the makeup after the makeup of the creation of this network. In 2016, we had held a first meeting that was asked by the PAHO, and Sylvia was a very important part of this meeting, so this meeting could take place. And we mentioned the different representatives of areas of education and healthcare, and the city of Bogota, and we had our first technical meeting. Starting there, we created the network of interprofessional Interprofessional Education. There were representatives of the Ministry of Health and Education from different countries. In 2017, we had and also in 2018, we made the third technical meeting in the city of Buenos Aires. And I highlight here with an arrow because and it was could organize the possibility to make an academic network that could commit and could start the interprofessional education. We can and we can also start this institutional professors.
Countries such as Brazil, Colombia, Argentina, Uruguay, Chile, Panama, as well as people that individually decide to join the network to work within each of those places into their professional education. This first technical meeting that took place in Colombia helped us constituting and hearing what you have told us today, and you felt very important. What happened with regards to how they made reference to the interprofessional education, because in reality, it is a matter that is happening not only with Argentina. So we have promoted the concept, the idea of what this interprofessionality means, which is quite different from interdisciplinarity, and is quite different. And in spite of that, we are trying to bring the presence of the concept of interprofessional education in the normative, in the regulation documents. For example, the medicine standard of accreditation. So to make reference to collective work and to learn how to work as a team, but this reference of interdisciplinarity, not the experiences of interprofessional educations. So, or of education, I mean. So you start working as a team when you learn to work with colleagues, with a team, and to develop projects. But a very different point is to learn how to work in a healthcare team within this concept of interprofessionality, to be able to achieve this collaboratory practice that we want to move forward with. So what we could see in this first technical meeting with the representatives of the different academic units that are in these places, there are several experiences of interprofessional education in the region. There was a space of knowledge, the ones that were part of this first technical meeting as stakeholders in this team. And there was an important need in the area of interprofessional education. And finally, what is happening in Argentina, this also happened in other places. So you mentioned that was mentioned also today, of the presence in the guidelines of accreditation of the careers, the normative frameworks, and the standards of accreditation of the healthcare careers. And so when we constitute this network, we said, well, let's work to try and cooperate academically. For a person that is interested, may take over. And for a healthcare school, may make use of that. So in fact, the interest that we've had was to contribute with our own development to see how we can help among ourselves to have this interprofessional education and to make it a reality within our academic units. In that way, to achieve that in practice and in the service, in healthcare services, the practice to be more collaboratory. So we start sharing experiences in countless meetings. So we've had actions, joint actions. And I must tell you that we have constituted in December 2019 and during the pandemic. So we started thinking how we could work virtually and to cooperate among ourselves. And we organized 4 commissions within the network that are working in different projects. One commission that approaches the curriculum and how the interprofessional education enters in the programs, in the study plans of careers. And there, the other commission working with teaching the teachers in the project of the training project to train professors in healthcare.
And investigation or research of many different countries in the situation that we are. And there is also a commission of decision and that works with social network and publicizing the information. These are different lines of work that we produced, and there are different presentations, and also working, starting with the investment of the interprofessional network and education, a network of interprofessional education. And when the pandemic started, it allowed us to find, or more than we would be able to, and because of our meetings, so we managed to share many experiences. And something else that I experienced was that Bruna made, and Sylvia also, was the fact that how to go beyond the education and how to articulate better our academic units and our medical schools and with the medical services. And one of the other issues that the pandemic mentioned was exactly when all of the universities closed, and they closed, and our college and other colleges around the world, the centers of simulation were open for the healthcare teams so they could learn a specific situation. And something else that I wanted to work specifically nowadays, the new reality of the world and the complexity of this reality, we help that the specific skills and the specific approaches of the patients, because fundamentally our professionals have to focus on the need of the patient and the need of the family. So the approach of different situations and the need of new capacitations, we also have to think in terms of the team of the healthcare team. So in the pandemic, one of the things that allowed us was to make it to think about the tracing of cases and the detention of the situation. And the same happened in the hospitals and the therapies that are the intensive therapy or the ICUs. The healthcare teams were the ones that mentioned that dealt with the patient and provided care for the patients in the pandemic. So the capacitation had to be carried out as a team, how to deal with a patient, how when the situation was not very clear, the infection, how it happened. And in some situations, it seems that they were very exaggerated, and now that they're not so more, so we have to capacitate these people so that they can take care of the people who need it. It's important for people to keep working so that the care can be guaranteed. So the capacitation has to be consider in terms of team. I will do this, you have to do this. We have to work jointly to solve the same problem. And the leadership has to be established in terms of the problems that are happening, and not in the professions that of the people within the healthcare team. So the leadership can be rotating according to the problem and the moment and according to the need. Well, among other things, and I would like to mention this because it seems they are very interesting experiences. Among these things that we could do, thanks to the virtualization of teaching, was to start generating workshops, professional workshops, and also international workshops as well, and meetings. We pulled together 3 universities of 3 countries and 4 different universities with all of the healthcare or health professionals and teams of 700 students. And we created different workshops and meetings to approach situations that were problematic in cases and people that had some difficulty in the care problem, and the healthcare team didn't provide the proper care. So, and starting with the reflection and the knowledge of what the other person would have to do, and how you would have, how the patient would have benefited in this circumstance, and if the team would work better. So it helped us publicize and spread the word, the interprofessional education. And among the questionnaires that we proposed to the students, we had 4 international workshops between last year and this year. The students, we were very interested in this practice, and they think that the methodology of work, we create small groups and they present a conclusion, and then we have a general panel. They say that this was a very enriching experience for all of them, especially to learn what other professions have to do and how they can collaborate within the team to make it easier and to make the other tasks of the other people, the people in the team, easier. And then in this way, the patient will also be benefited. So these experiences were for all, and these meetings were very important for us, where we started to add more and more teachers and professors in terms of the interprofessional education issue in our academia or in the universities. And that was the first international conference for the professional education, interprofessional education in November, where many people took part and they presented their experiences. And one of the questions that were mentioned was that they started to be more interested in the interest and the initiatives and the research in education, interprofessional education in Americas, and they saw it as someone extremely positive and an indicator of what we see in interprofessional education that is taking place in our region. So among the conclusions that I managed to reach, it was that the pandemic allowed us that the use of technology, and it came here to stay, and it made us get closer and to work more closely in the generation of these points of meeting points. If without the technology and without this means, that would have been very hard. And they can see they are still a very important strategy, and we need more technical knowledge in terms of IT skills for the teachers and professors, so that they can accept the experiences, to design these experiences in different academia units, and the work in network of and the international intersectorial articulation. They say that it's over 500 people were capacitated. They are capacitation that came up from for the healthcare services and the help and the collaboration and this capacitation. And it's a free of charge. A group of professors from our college participated that started to capacitate these professionals in the healthcare team in a collaborative practice. And I believe that on this side, it's the way that we have to take. And it seems that it's very interesting for me, so we can share these experiences, to listen to an experience to another person. It opened my mind, and it allowed me to say, how can I do this in the college? And Americans usually say that they talk about champions, and I believe so. Champions of interprofessional educations, we have to push it forward, and the possibility to go further. And I thank you very much for listening to your experience, and to say we also are interested because in Argentina, we have a similar situation, this in spite of our efforts. And the new documents of medical careers, the word is interprofessional education. It's not present in this new document, and we're going to continue talking about this. So thank you very much, and I hope that my contribution has been worth it.
Thank you, Dr. Larissa. What she's brought is very important perspective and strategies for us to advance interprofessional education. And I'd like even to highlight some of the areas that she brings us. And it is important to rethink our reality in different institutions, in different spaces that we take up. And so there are elements of curricula, training of professors, and the visibility of the theme. What she brings in the network of professional training. So, and the complexity of this team. And what she's brought, well, and it shows that the importance of a political will as well as leadership. I'd like to thank Professor Larissa for her contributions. And I'd like to invite our participants to make their comments, to share their thoughts. And we learn from the experience of one another. Thank you very much, Dr. Larissa. I'd like to invite Dr. Gustavo Njunta. He's a specialist in public health systems and emphasis with human resources, has a master's degree in anthropology, social anthropology, University of Mexico, in the London Tropical Medicine School. She also studied the economy school in London, has been a researcher and with different multilateral demands. He develops currently complex adaptive systems. Thank you, Gustavo Nihenda. You have the floor, sir. Thank you very much. I'd like to thank you all for the possibility of participating in this event. It is a very important one for a theme that, well, and for the reflection that the theme brings us to generate here on. Well, I have in my presentation 2 cases that I wanted to show you. But before that, I'd like to start with a reflection around the interprofessionality. Well, for me, well, it took us many years, especially in Latin America, working with the concept of healthcare teams, the different countries that are here represented. And there has been policies and programs to work with the healthcare team, first in attention. And there's a large history behind it, at least 3 decades and even more in this concept. But it is very interesting to think why at this moment we're talking about interprofessionality after so many years talking about healthcare teams. Well, somehow we are, well, to show what we're trying to do here. When we talk about interprofessionality, well, this reminds me on the relation of different professionals in professions in healthcare. And there's a sociological view that I've shared with my dear friend Marilena Machado of the Public Healthcare School of Rio. And sociologically, we're talking about certain groups of professionals. We're talking about people that usually have university training in masters or and on what they usually led the healthcare services, but recently we have found the emergence of different professional groups that start to take up different spaces and that are offered. And so those spaces have been offered. And there's a history that comes from the healthcare teams when they work with interprofessionalities. For me, it feels that, well, we discuss not only how the healthcare professionals work to coordinate to the healthcare provision services as well as other technical groups, especially nursing. In Mexico, half of the nurses, they are working for different institutions in the university, but nevertheless, we have nurses from technical levels, the technicians. And what is the space that they take up in their professionality? So now I believe the idea of interprofessionality is a very powerful idea, certainly, because the difference in the healthcare teams, well, they wanted to integrate the groups organized within the services to generate a continuity of healthcare for the patient and references and part of the counter-reference processes. And we're talking about currently that we can start the interprofessionality theme from the very start of the training. Something that they didn't do before. Well, it was in situ before in the practice space, but never starting from initial training. And they're important measures. For me, one fundamental one is what values are you going to share among each other? The fundamental values of equity, justice, fairness, freedom, together with cooperation. Those are values that we must foster from the very beginning. And we have included that in the professionals. And we have the same values. Another important, and what are the objectives that we have with professionals? We have the professional objectives, we have the institutional objectives as well, or the systemic objectives rather. We have and the different levels of health. So I believe more than the objectives that each group may have, they're of course legitimate. We must think about the systemic objectives and outcomes, and this must come from the very beginning of the interprofessional education. We have this relationship for many years, well, has been quite conflictive. We cannot just say that this has been everything quite well and took place, though there has been many moments that the professions that participate have had very clear differences with one another, and how to make those differences to be established well in terms of what each one may bring to the system sounds important. Well, it's important for me. And even said by the previous speakers. And just as a general reflection that I wanted to do, because I believe this is an extremely important theme for the future. And here, what I'm going to do is I'll tell you about two cases, and that was documented in Mexico. None of them has a formal research behind it. Basically, well, we know this is a quite relevant topic. We've have made researches that that would bring, well, the pilot or the inception of this, and then allow us to create a more formal research. So I will request Julian in charge, if you can go to the next slide, please. The first case has to do with the organization, the collaboration that we have in with the Organization of Civil Society in the state of Chiapas, Mexico. So we have an agreement, a cooperation agreement. We should, there's a set of interprofessional training. Well, our dear colleagues, well, the fellows in health, compañeros en salud, it offers services to the rural population and controls with the state Secretariat of Health, 10 healthcare centers, 10 healthcare units, rural healthcare units, and they offer healthcare for this population. It started since 2011, these zones, and they incorporated them first. So the university students, or the grad students, to have this title, they must spend 1 year in social service in rural communities, basically. So as the time went by, the organization has incorporated also nurses. In 2011, they add this motherly healthcare or mother healthcare system. So more recently, what we have achieved, well, we wanted to add the nurses in the primary healthcare units in the rural areas, and not only in where the mothers are. So this is this is just to introduce a set of alternatives of training, or professional training in organization, to offer someone a diploma of global healthcare. This graduate, this bachelor in global healthcare, has many themes, and considering the elements that we've been talking at first. But the idea is, on one hand, to bring the medicine and the nursing students and other technicians, well, the social healthcare determinants as fundamental for rural populations. And a good portion of the work that is done in cooperation, and basically to teach them how to improve their clinical skills, in separate, of course, the nurses, the doctors, but to have a joint cooperation. Other elements that are with regards to the values of healthcare is the marginal population. So to be able to see to these populations, to bring skills and deliveries and the total commitment to be able to maintain, well, to keep them for many years, with this idea that I'll go back to the city just to finish my training as a specialist and so on and so forth. Well, first there's a whole training process with values and principles, and then to understand what people receive from them. It's extremely important, because it's a difference between life and death. Next one, please. Well, although this is not a formal work, because we were able to generate some literature in this case, and we have the interviews with different nurses, nursing schools, and as well as med schools, the ones that are in charge of the program. in the interprofessional design. And we published them in a journal called Interprofessional Care Journal, quite interested in this type of themes. Next one. Well, the second case that I wanted to comment with you, well, the first one is the first level of healthcare, rural populations. And here I'll talk about the a specialty center in Mexico City. So the med school, as well as the NEO, they have an agreement with this medical center to train nurses, doctors, and the technicians, the nursing technicians, in their last years of training in the hospital. And in the hospital, the idea is to start integrating different forms under which you can send forward technical information and some elements in terms of the skills both professionals may have to integrate from that moment on and to take care of the patients in the hospital. Next one, please. So the medical center and these corporations, from this corporation, an agreement was started for the students to spend a season there, and the hospitals put their facilities and the professors, as well as the med schools and the nursing schools, also participate with their professors, and the university will have the students, will bring the students and to define the academic program. Next one. Well, what we're doing, it is a continuous qualitative follow-up. In each of the last 3 generations, we have done focus groups with the nursing technicians, but I expect that when we have a formal studies, we may integrate them. But what we're observing the perspective of the nursing, and the results are very interesting. So I enjoyed the experience because the students have shown a great trust in what has happened in the school, and the principal is here, or the dean of the school is here with us. The socioeconomic differences, the existing differences with the other students, the nursing students, and you see the differences in terms of the social groups and in terms of the training of the nurses. And the nurses also have that, well, of the med students, especially the execution of some healthcare protocols. And nevertheless, well, it's interesting to incorporate the doctors because we want to see that happening in this type of situation. In general, the experience will be quite valuable for not only for what the nurses learn, but also to have the hospital experience. It opens the possibility of building a career within the hospital with this type of training model that can be executed in practice. Next one, please. Well, we're working in this academic report that this summary of the main points of this research and some final reflections or points of discussions and remarks, because we are not expected to have conclusions on that. So you have we see the differences that we're able to document, but what we have seen in Mexico is that we have experiences in the first level of healthcare as well as the hospital care. And it's interesting to see that because it's not only one type and the differences of groups that they're establishing some careers, some social differences among groups, in a whole group, in the professional and social prestige to bring the differences that comes with this objective of professional training, and the objectives are in the future a clear share of functions, a different role that will have the doctors and nurses in a clinical setting, and in the existence of a legislation that shows the roles of each one of them and how to train them on how to work in an integrated fashion from the beginning of their medical training. The interprofessional practice favors the continuity of the healthcare and the assessment of the patient clinically, in the link between prevention and individual personal healthcare, and the experiences and promote the expansion in the healthcare institutions. Until this moment, we have this type of exercises that are more observational, but I believe we should start to see the possibility of doing an assessment where we can introduce intervention that may be assessed in such a way of what would be the benefits of a model of that type. So more than observational to the more demonstrative courses. Thank you very much.
Obrigada pela apresentação.
Thank you, Dr. Gustavo. I'd like to highlight a couple of points of Dr. Gustavo, and he brings elements that are very important to be considered, and those are values and objectives of the alignment of such objectives in the education with the healthcare system. So it brings us some perspectives with regards to intersectoriality and strategies that bring the universal healthcare perspective. And also to highlight in Dr. Gustavo's work, the social responsibility of the healthcare professionals and the people, the population in vulnerability situation. So finally, Dr. Gustavo brings themes that are challenging, that have permeated the discussions or reflections in the interprofessional education, which are the role of competences, of skills, and the very regulation of the healthcare professional. And I'd like to thank Professor Gustavo for his experience and the lecture that makes us reflect on what has been said even before.
Obrigada, Dr. Gustavo. Quero aproveitar para também destacar alguns comentários que nós vimos aqui no chat, de algumas experiências de outras instituições. Temos aqui a Kelly Pereira, da UFTM, do campus Araguaia, que menciona que na instituição deles, né, foram instituídos 2 componentes curriculares sobre educação interprofissional e prática interprofissional colaborativa, como atividade de extensão, que também está alinhado com a fala inicial, com a apresentação da professora Sinira, com os resultados que foram encontrados nessa pesquisa. Ela coloca também, a Kelly, que essas alterações foram possíveis a partir da vivência do...
She also mentions about the experiences in the pet saúde and interprofessionality. And Bárbara Rocha also mentions her experience in UFG and the Federal University of Goiás, and the experience of community internship, and that it's a long time experience, and also related to the PAHO interprofessionality. They created a common plan for nutrition and odontology, and that was not included in the project. So that's an important information, especially due to the fact that the result of the project of research. So even if there are actions, they are not necessarily formalized in the documents of the course. So for the final remarks, and to mention all the topics that were mentioned so far, I'd like to ask Professor Marina Peduzzi and her impressions about the presentations and her own experience. Professor Marina Pedruzzi is a nurse. She has a master's in the University of São Paulo, doctorate by the University of Campinas, and the practice of interprofessional education by the University of London. And she is currently a professor of the University of São Paulo in nursing. She's the leader of the group of management and in nursing in the perspective, in the collaborative perspective, and interprofessional as well. She has experience in the management and everything related to healthcare. She works about working teamwork and professional education. Professor Marina, it is a great pleasure to count on you today, and I would like to pass the floor. Thank you, Bruna. Thank you very much, Bruna, for the invitation of the nursing school of in Ribeirão Preto City and the PAHO that organized this event. It's a pleasure to be in touch firsthand, to have in firsthand the results of the research that was developed by the school of the college or University of Ribeirão Preto, and to listen the experience too of Professor Gustavo and Larissa. And also, initially, I'm going to make three remarks that I prepared. I'm going to stay within my allotted time. So I ask you to help me to not to go over the time limit. And starting with the results that we got from the research that was carried out, I was thinking about it and I wanted to point to three aspects, and after that to continue with some other points about the contributions of the colleagues that preceded. The results of the research that Sinir presented, a big group that was developed, many colleagues from Ribeirão Preto, and one thing that draws attention or that stands out is that they identified over 1,300 schools, and they concluded with 1,200 courses. So around this, it's around 1,300 courses. And around these courses, in the nursing courses here in Brazil, there's 1,200 to 1,300 courses. And we had a research, a study a few years ago with the help of PAHO, and we identified that there were 7,000 courses and graduation of health here and in health sciences, and nursing is around 18% of this amount. And Brazil is a continental country, as is the case of Mexico and Argentina. But this is data that we need to look at because it is a scenario where it takes place, the interprofessional education in nursing. And in a recent study that was published in the Latin American Nursing magazine, and with the help of Ribeirão Preto Medical Nursing School, Nursing College, it shows that currently we have 193,000 places to graduate nurses in college, and 87%, almost 90% of these places are in the private sector. 82,000 positions, or these places out of this 100,000, are in the distance or remote learning. I'm drawing attention to these numbers because numbers are not only, we have to consider other factors and human relations too, we have to take into account. But it's important to think about this, about the careless and disorganized increase and the increase in the accelerated and disorganized increase of the number of nursing colleges. And what is most worrying is that with the rising of this number that is taking place in the past 20 years, it's hard to regulate and the quality of education. Brazil needs more schools and colleges. There's no problem in it, especially because we have an inconsistency with the data as well. It's more than inconsistent, it's a contradiction with the data, because here in Brazil we have more than 2 million workers in nursing and around 2.4 million, and just 24% are nurses. So 75%, as Professor Gustavo mentioned, that in Mexico 50% are licensed nurses. It's 25% that are 24% that are licensed nurses. At the beginning of the 80s, 35 years ago, it was just 8%. So in 35 years, we went from 8 to 24%. I'm mentioning this because we need more nurses, but we have to think the results of the study that Sunita mentioned, and along with the contributions of Larissa and Gustavo in the scenario, which is a scenario that is tense, that shows many points of tension here, especially concerning the quality of the education to get where we want to be, where is the quality provided for healthcare. Education itself has the goal to provide professionals, to provide more access to and more quality and security in the healthcare service for the population. So that's why I highlight this point. And it's true that it shows a panorama that is really hard. And we're going to have another study that is very interesting, and it was published in 2003, that has a panorama in the nursing area in the country, that was published in the Brazilian Nursing magazine. The author was Elizabeth Teixeira, and back then they had cross-reference with the information of the ENADE, which is the exam of assessment of the students, and in 2010 it was also it would also assess the nursing schools, the nursing colleges, and 43% had score 1 and 2. And ENADE assessment goes from 1 to 5, and 4 and 5 are the highest marks. And in 2010, the result was 43% with scores 1 and 2. So what I want to say here is that the situation in which Sunita that mentioned, and that the research that was carried out, that shows very clearly a fragility, the early stages. We are in the early stages in the interprofessional education in the nursing colleges, and Larissa also probably mentioned in the education of all health professionals. But we're focusing here in the nursing education. So this picture that Sunita mentions, the fragility and of being to be at the early stages, which in itself is not a bad thing, because we have a lot of things to do. And we're here gathered because we want to strengthen, we want to broaden education, professional education, and facing this complexity and the healthcare systems, we have to broaden the interprofessional work. So there's nothing really bad in itself. But these are the first stages in a difficult scenario. That's the first point that I wanted to mention here, which is a scenario for which we have to pay attention to, which is this extremely accelerated growth of courses without proper regulation and to monitor the quality of the studies. So that is the first issue that I wanted to mention. And the second issue regarding results. And what Sunita mentioned, and that is an important contribution that we have. And because I'm working and with these issues and the topic for many years. We've been working professionally, and I was surprised by the results. So I had an expectation that I would have another situation because nurses work really hard. When I talk about nurses, of course, most nurses, female nurses are majority here in Brazil, but male nurses too. And they're connected to the coordination of the teams and the work that stands out the fact that there is such a limited presence of interprofessional education in our courses of nurses, in our nursing schools. So 2.6% aim the goal to teach of interprofessional education. So this goes forward regarding the values, but values are extremely important, and the Center for Education in North American Education at the University of Minnesota that is also designed a framework of reference. They highlight the importance of the values for the interprofessionality. And it's very important to highlight this, Anita. But values have to be consistent and have to be articulated with the goals and assessments and assessment strategies. And in reality, even though values have an express important figure, they are not consistent and articulated with the objectives. And the assessment of the goal is of the utmost importance. It shows us where the student wants to get to. What are we going to ask of the student if we're not asking interprofessional education? It's because it's at the early stages. Because when it is popular and when it is consolidated, it's going to show up in the assessments and also in the goals. So what makes me think that interprofessional education doesn't appear in the political pedagogical projects with the two elements that are fundamental for its presence, which is intentionality. We have been working with this here in Brazil. And we're starting with a proposal of the American group and Barbara Branchi, which is to what is the center of interprofessional education? From my point of view, it is the shared learning that between students of different courses. So the interprofessional education is a component of the pedagogical project. The pedagogical projects will be also centered in specific areas, and nursing schools will have a school and nursing students, and these areas will take up most of the pedagogical process. But the interprofessional education is a component that is a part of the curriculum, and it comes and it is part of this curriculum, and its importance and to literature has shown that it has this been part of throughout the years. That's the intention, it has to be clear. So to have experiences of teachings or education experiences that so students that will share in interactive way. It's not to be in the same classroom, but to develop activities that are together. So each one will develop what will learn about the other person, what the other colleague is studying, and how he assesses this patient. And from the medical perspective, what are the main needs of the patient? From my perspective of nursing, how do I see this patient? And that is what I see as an interactive and shared learning experience. So that is the moment that is part of the curriculum. And what is the intention behind it? Is that available and the student, and it promotes the student to have this learning experience with the clear intention that he will develop cooperative competences for the work team, for the collaborative practice, to understand, as has some example studies have shown us, that interprofessional work and interprofessional team and interprofessional education will contribute to improve the security of the patient, will contribute to improve the quality of care and the access, the universal care, access to care. So these two are very important components, and the results that the group of Ribeirão Preto, what they've shown, they worry in this regard because it's fragile, and this is not an easy task because it promotes this learning experience with the students. And another aspect here that I'd like to highlight, and Clarissa mentioned very interestingly, and the Professor Gustavo also mentioned, that the difficulty that we have in the topic, and we are activists of the topic, the terms, the lack of precision of definition of the terms, and the review that was made in 2009, and it was identified, and especially now in the basic unit, and it's no use calling it like a multi or inter team. When we're working with research, these definitions, these terms are extremely important because the research goes forward depending on the consensus that is built around constructs. So that is a main concern, and that actually takes place. And lastly, the need to guarantee this for nursing, because I am a nurse, and I've been working very deeply with this topic, and along with the nursing aspects. And it's not only in nursing, I also work with other areas as well. And if we can stay in the healthcare area, and for interprofessionality, it's important to interact between the communication. We also work with paradigms that are obstacles that that makes the advance hard. So, and in social interactions, we work with the interaction between two different people, and the individual care, and in the relation between professional and patient, as if there is an independent professional relationship, regardless of the world and the environment where the patient is. And the interactions are always social. There is a text of Paul Ricoeur in which he discusses hermeneutics, and every interaction is social, because once you finish the discussion, you have actions that we will have repercussions in other moments as well. So interactions are always social. So we keep insisting in an education in which interaction is limited to the individual situation, which is fundamental. My clinical experiences with mental health care, and I know how important it is, the interaction with the user. But this meeting has to take place in the world, because the patient has a life at work, has a social life as well. And these are issues that make it difficult for interprofessional education to take place, because we're always providing individual care, and we also have this individual paradigm. And the other conception is the conception of communication of a monologue, which is the emitter and receptor and the message. So we're also in the paradigm of the individual, the individuality. So communication in education and interprofessional education is related to bring some understanding for the construction of common plans of care. So the communication is not to do with the fact that we need to communicate. It's because we have to build these plans of care for patients and families and communities. And to have a joint plan, we have to interact and we have to communicate. So I'm worried about the paradigm that is too focused in individuals, because here communication is not the emission and the perception of a message only. This is a paradigm that is connected to the monologue. We have to advance in the dialogue, and we have to in order to construct these action plans that healthcare will execute and the care of the therapy.
And just to close, well, let me see here. Well, I believe I wanted to highlight that what Professor Larissa has brought. And this is extremely important for the interprofessional education, the integration with the system and community, the integration with the community and university. In my experience, the interprofessional education takes place, especially in the practices in the moment that the students are serving. They are in contact with the users, with the professionals that are in the field. So this integration is fundamental for the interprofessional education to be executed, and the focus in the needs of patients. I fully concur with, and Professor Larissa has shown a very important element or a very important aspect, because the focus on the patient, which I believe is a change that the healthcare system is attempting to bring. We're talking about interprofessional education, but this concern with the changing focus goes beyond interprofessional education, and it is fundamental in the interprofessional one, because this change in focus in services and professions for the needs of patients they displace, they bring everybody in a more collaboratory dimension of more integrated work. So I believe these are extremely important topics for it to advance in, similarly to what Professor Gustavo has brought to introduce the interprofessional education also in the clinical dimension, in the development of clinical skills and capacities. Well, we are very far from that yet, but this is something that is still in our horizon, and it is very important. Even thinking about this very challenge of the care plans, if we share care plans, well, the clinical care is also ever present, and many times the frontier among the areas, they're not made sufficiently clear, and it's important for them to be, but at the same time, as they are becoming more and more clear, we expose an overlapping of these frontiers, these borders, because there's a set of activities and cares which are common in the different areas, and that configures different borders areas, and which tends to cause conflict. And in the perspective of interprofessional education, in the interprofessional practice, it may not constitute conflicts, but to enlarge, well, each one doing more, each of the professions to do more. And finally, the memory that was brought by a participant here with us, and within inductor policy. Well, we have here in Brazil the fostering policies, actually, with the Ministry of Health. We have a set of initiatives that we called fostering policies, or inducting policies that try to foster the higher education institutions into change their training and reformulate, if I may, the training. And our example in Brazil is that for interprofessionality, the PETs, the education, labor, or work programs, the PET Health. The last edition was under interprofessionality. In fact, is a very powerful project to promote interfunctionality. I had I work in 2019, 2021. Several institutions participated. We had 7,000 people with the faculty and the student body. So it was very rich, of course, with all the diversity of functions of institutions. But I totally agree. It is a very rich initiative that may help us in this interprofessionality. Thank you, Dr. Marina. Thank you very much. And Samina, and they talk about the domain of the topics. It's all everybody grateful. Rodrigo mentions the experience of a group in Bahia that have reformulated this interprofessionality with 10 courses when they are collecting data, and shows that they're going to disclose the process, the interprofessionality work. And thank you, Rodrigo. We expect the data. We still have some 15 minutes of this event, so I'd like to take the opportunity just to bring questions, but to the questions that came up on the chat, and I'll make use of Professor Marina's work that she talks about imprecision in the terms, and I have Susanna Schaudi that asked, well, why do we talk about interdisciplinarity when we could talk about transdisciplinarity?
Podemos começar com professora Larissa, Gustavo.
We can start with Professor Larissa, Gustavo, or I can continue as well. So Professor Larissa, for Professor Marina to have some water. Well, yeah, of course. Well, I talked about that. Well, one has the interdisciplinary approach. You approach from the different views and the interrelations that are produced. The transdisciplinary approach goes beyond that, but it's not the same interdisciplinary and interprofessionality. When we are talking about interprofessionality, we are talking about a meeting of professions. So if the approach and the study of the patient is done from the interdisciplinarity, but exists, as Professor Marina mentioned, there's a effective communication in this team, a cross-cutting communication, a democratic leadership, a knowledge of the roles and approach. Well, that makes us study this object from the interdisciplinarity. So those are different things and different concepts that the interprofessional education brings, and that has to make clear. What you're proposing are different issues. They're not excluding, but they're different. So for me, from this point, we must understand, and the interdisciplinarity, they collaborate in the interprofessional approach, but it's not the same to talk about interprofessional education or the interprofessional approach as well as interdisciplinarity. Those are different things. They are cooperating among one another. They have synergy, but they're not the same. Okay. Perfect. Professor Gustavo, would you like to add anything with that regard? Yes, thank you. Well, I fully agree with Dr. Larissa with regards to the fact there are two very different elements. So I believe there are elements which, the values that must be transdisciplinary. We will see the same things among others, but there are differences in terms of technical training and the clinical training that does not allow to be transdisciplinary. and the interdisciplinarity. Well, the transdisciplinarity cannot bring those types of elements, such as the values may not be transdisciplinary as well. Here, there's a mix that, well, I believe Dr. Marina, well, we need to be aware of what each of the concepts mean. Well, I take another minute. I just wanted to comment the theme of the research. I believe the research is key for the development of the interdisciplinarity in healthcare. And I wanted to take this moment to talk about demonstrative studies. The National Nursing School has a laboratory, quote that the Community Nursing Medicine Center. Well, this is a healthcare center that is in the south of Mexico and has the commitment of training the professionals, but under an interdisciplinary view in to provide healthcare services in this. This lab is the ENEO decides who and how does it. And in fact, not only there are doctors and nurses participating, but also we started to incorporate psychologists, nutritionists, and the future plan to create an interdisciplinary team that is wider, that would improve the bonds that we have with community, because the communities, they have needs that not any two professions could take care of all that. I just wanted to bring that because some of the things that Marina has mentioned, somehow, well, we could use this type of project as what type of adjustments we must do in the process, in the previous process. And the other missions in the training, as well as in the very practice in the Ministry of Health and other institutions. Thank you. Thank you, Dr. Gustavo, for your contribution. And first to advance towards other points, I will invite Dr. Larissa. And there is a question on the network of interprofessional education and how this network has cooperated to qualify the professionals that are in learning institutions but have not had any experience in interprofessional education. Well, at this moment, we are in the creation, the inception of this virtual training to train to teach the teachers, basically, to train more professors that may be, well, as we call it here, multipliers of that, or to spread the knowledge to the regions of the Americas. But what we have done, and it is in each of the institutions, is to make use of the training courses of teachers to include the approach of interprofessional education within one of the modules. And this year, and the complete module of interprofessional education. And we have nurses, we have biochemists, doctors, psychologists, and midwives. And this is one of the modules that are mobilized and interests us because they propose other forms of work. Well, to think strategies, as I have shown previously, and as Professor Marina has mentioned, for instance, in the work of the teams in the first level of healthcare, to be able to reflect upon the practices of the students and the preparation of the practice in the first level of healthcare and the community work and the territorial work, to have a interprofessional training for us to prepare for this practice that will be done in a joint way for us to take that forward. And we'll make us reflect together to be able to understand this reality under the light, in the light of the different views. So, and this is interprofessional work that can be done initially in territorial level, in the community, to take place throughout the study plan. So we must have the different trainings in different moments of the programs or the curriculum proposals, because we also need the clinical area for that to be enforced. So that's what you talked today, that one of the comments in the chat of the importance of simulations, or simwork, is a extremely important tool for the training of interprofessional education. Professor Marina talked about communication, and one of the questions that can be brought in the simulation is the communication and decision-making process, especially when we're talking about the hi-fi simulation. So in a more real scenario, not in a scenario that we're learning how to do this procedure or create a vein access. No, we're talking about how to approach a situation. So this simulation needs to be a high fidelity. So basically, to be closer to reality, it's so close that we will be nervous, that we don't know how to react upon it. And this is part of the training that we do in the interprofessional education, where a bit Professor Gustavo has mentioned, when we are under the same situation and we generate a scenario of interprofessional education in a simulation, and for instance, we are in a situation, an emergency situation, where we need to make quick decisions. What happens is the students, the advanced medicine students, and nursing as well, they learn a lot with the nursing students, because the nursing students in Argentina, from the third year, they are in the labor world. So the students that are in the last year, they have all the experience, the labor experience, and learn a lot. So from this moment, the decision-making moment, they can collaborate much more and have a more prominent leadership than the medicine student, because before having their diploma, they cannot work. So it's quite interesting and allow us to reflect that with the students on how they should produce this cooperation, this effective cooperation in the healthcare team. So for that, I say the interprofessional education and the existence of a specific module in a study plan that is called interprofessional education, and as the others, we have an international center where we can guide the interprofessional education and to the safety of the patient, to the patient-centered attention or healthcare. And I myself as a patient, I also decide what is best for me. And this is one of the moments of the study plan. So we start with the insertion of these strategies in different moments that would allow the students to continue reflecting. And it's important to work with the others, even for the work to have more and better effects and better results. Thank you. Thank you, Professor. Thank you, Professor Larissa. We have 2 minutes. We have 2 minutes out. So there would be other comments or other questions that have been asked on chat, and talks about the work group, but due to and respecting the time that we must meet, we're going towards the end of this event. And I'd like to thank immensely all the lectures and everything that has been brought here, and for the work group, as well as for the other ones that are watching us. This event has right now, this has had the participation what we have with this nurses that work in the Ministry of Health. We have professors, we have members of the student body who have different perspectives, different looks. And what we expect is for the lectures, all the panelists to inspire us and all the group, in a sense, that all of those participants become champions of interprofessional education. Finally, I want to say that on the chat, there is a link for the ones who want to receive their certificate. Just fill that out, and there are questions with regards to the recording of this event. This content is available in the Nursing School of Ribeirão Preto on YouTube and will remain there. So you may all watch and share with the contacts. So once again, thank you very much. I'd like to thank all the participants, all the panelists for the great event. Congratulations to you all. See you next time. Thank you.
Obrigada. Obrigada.
Muchísimas gracias.
Tchau,
Muito obrigada,
tchau.
pessoal. Que alegria.
Gracias a todas y a todos.
Graças a todos.
Obrigada, Sinira. Obrigada a todos.
Muchas gracias. Un placer haber
Muchas
compartido con
gracias,
ustedes.
obrigada.